expertise to share with us how God has trained him and is using him. So he's going to explain to us what he's doing here today, and then he's going to take some questions and give some answers. And it's all yours, brother.
Thank you so much.
Thank you. As much time as you want.
Thank you, brother.
Yeah, if they start leaving on you, it's just me and you, it's over.
Hello. So my name is Sharam Sharif. I'm a naturopath. I've been a naturopath since 2004. I'm also a homeopath, licensed homeopath. So just out of curiosity, how many of you guys have a naturopathic doctor that you see or have seen? Can you, just a few. Okay, 4 or 5, not bad. Have you ever seen a homeopath, or have you ever received homeopathic care?
What's the difference?
I'll talk about that in a minute. But if you haven't heard of it, then you probably haven't had the homeopathic. Okay, so let me just bring up. Okay, so I have my own practice. I'm in Kent. I also have a site office on Queen Anne. I work full time in Kent. So this is the website for the Kent location right here. It's drsharif.com. And this one is the website for the Queen Anne office, where I just basically treat skin diseases using natural therapies. So it's Dr. Derm Indy. So I have 2 websites. My main location is in Kent right here. I have given a lot of various presentations on just about every subject. And here are just some of my videos, the videos of various talks I've given. You can go view them as, you know, if a particular subject interests you, you can just go watch them. They're all on my website. This might interest you. Before the pandemic, Lord put it on my heart to give a talk on prevention and treatment of pandemics. That was like a few months before the pandemic happened. That's the talk right there. Homeopathic management of COVID and post-COVID. I gave that in August of 2019. And I had been working on it for a couple of years before the pandemic happened. And I was sure we're going to have a pandemic. Lord put it on my heart. People are like, how did you know? It's like, how was I supposed to know? Lord put it on my heart. So that talk, it took me 2 years to put it together. And then a couple of years into the pandemic, I gave a talk on overlapping pandemics. And that also, each of those talks takes like a year or 2 to put together. So that's when you have multiple pandemics at the same time. Like we had RSV and COVID and the flu. Remember, a couple of years ago, we had overlapping pandemics. So how do you diagnose someone that comes in with various symptoms? How do you know if it's COVID or the flu or what? And how do you manage it? With all due respect, I think conventional medicine, they just don't have the perspective or the treatments to address pandemics, let alone overlapping pandemics. Homeopaths have treated pandemics for 200 years, and they have a lot of experience. So I dug up all the books and did a ton of research, and I've shared all of my research that's available for viewing. So those are some talks there, and they might interest you. So Pastor Ruben gave me a list of questions yesterday that you guys had asked. They wanted me to respond to. So I'm going to try to respond to each of those questions briefly, as best as I can. But before I do that, this website, the Kent website, the drsharif.com, has all kinds of resources. You may want to just, if you're interested in natural medicine, you would want to just check it out. To answer your question, what's the difference between homeopathy and naturopathy? Homeopathy is a branch of natural medicine. So naturopathic physicians, at least in many states, not all the states, we're licensed primary care physicians, but we use natural therapeutics to treat disease. So but we are considered primary care. And homeopathy is just a branch of natural medicine. So you don't have to be a homeopath to be a naturopath or vice versa. Most naturopathic doctors like me, they don't specialize in homeopathy. Very few do. So I'm like the only homeopath in the entire South End. There's like a few in Seattle, maybe a couple in Bellevue on the east side. And homeopathy goes back 200 years. It's from Germany, and they use highly diluted substances that are potentized to treat just about anything. So we have like 9,000 homeopathic medicines available for all kinds of ailments. And most people are not aware of that. Most people know about herbs and nutrition and nutrients, but they're not aware. They don't know anything about homeopathy. Like, what are homeopathic remedies for? What like are the remedies for any condition? I mean, they wonder. They're like, is there a remedy for warts, or do you have a remedy for COVID, or are there homeopathic remedies for cancer? And I'm going to get to that. I'm going to answer that in a minute. But basically, it's a branch of natural medicine, and the substances are highly diluted and they're potentized. So they're stronger than regular herbs and nutrients. Does that give you some ideas?
Yeah, it's more Eastern medicine than.
No, it's not Eastern. It's from Germany. It's Western. Yeah, and we're Western trained physicians, naturopathic physicians. Yeah, most of what I know is hardly any of it is from the East. It's all Western, like Western herbs, and homeopathy is completely Western. So yeah, I unfortunately don't know anything about Eastern medicine, like Chinese medicine. That's not a part of my training. So let's address the questions. The first question was, how do you know your liver is not functioning properly, and what's the best way to heal a toxic liver? There are no really amazing blood tests or tests for the liver. You could have liver cancer and still have normal blood tests for the liver. So there's really no reliable testing for the liver. If the tests are normal, that's good. But if they're abnormal, then it's obvious. But if the liver tests are normal, that doesn't mean your liver is functioning normally. You could still have significant liver issues, even with a high functioning liver. I mean, even with a diseased liver. Does that make sense? So let me give you examples. If you have digestive issues, those are the examples right there. If you have digestive issues, hot flashes, menopausal symptoms, headaches, many skin conditions, majority of hormonal conditions, basically they all, for the most part, stem from poor liver function. So I just mainly go by signs and symptoms. So there's no amazing way of deciding whether someone's liver is functioning or not. So if you come in and complain of headaches, I'm just thinking, oh, there's a 90% chance your liver is compromised, and the blood test won't show it. Women going through menopause, there's like a 99% chance the liver is compromised. It needs support, and their blood testing for the liver may be normal. Migraine headaches, 9 out of 10 cases is due to poor liver function. So these are things that conventional medicine doesn't address, because in conventional medicine, we rely heavily on tests only. And so signs and symptoms matter, but not as much as they would, I think, they do in natural medicine. In natural medicine, we mainly go by signs and symptoms and your history. So if you tell me you have migraine headaches, you've had them for 20 years and a couple of migraine headaches a week, I'm immediately thinking your liver has been compromised without any blood tests. So we go by signs and symptoms and physical exam and history. And regular doctors do too, but they put a lot of emphasis on test results. So, I mean, this is sad, but our mother had liver cancer and her liver tests were normal, even until the end. You heard about that. So our mother passed a couple of months ago, and her liver tests were always normal. Did you know that? Her liver tests were always normal, and she had advanced liver disease, tons of tumors, and the liver tests were normal, even until the last 2 weeks. So you really can't go by blood testing, and that's something that I wish people would realize, because people rely too much on tests. So the second question, what do you think about our technology? New technology that can help us scan the human body or blood for certain diseases like cancer, stroke, dementia. There are a lot of new tests coming out, and I certainly don't know about all of them, but I know about some of them, and there are some that are being researched as we speak. They're best used as one piece of the overall picture. So you don't want to ever rely on a particular test per se, but you want to use all the tests together to kind of put the puzzle together. And are there good tests? There are lots of amazing tests out there. This is just to list a few. Like these are my favorite right there. For stroke and cardiovascular disease, you see those the tests in red. So there's a test called coronary artery calcium scoring test. It's a CT scan of the heart. I think cash is like $200 or $250. It's not expensive if you don't have insurance. It's not that expensive compared to other CT scans, but it can detect coronary artery disease like way in advance. So I do that for patients that have a high risk of cardiovascular disease. So if someone comes in, let's say they're 65 years old, and they have high cholesterol, high blood pressure, overweight, history of, let's say, smoking, I'm thinking they might have plaque. So let's say their cholesterol, they don't want to take statins to lower the cholesterol, and they don't want to necessarily change their diet either. So I'm thinking, just looking at them, a lot of times I can tell if they have plaque. You can tell there's a certain body type. And if I don't know either way, I'm like, you should do a coronary calcium scoring test. And I've had a couple of patients that their score was like close to 1,000. It's supposed to be 0. Like you're supposed to have 0 calcium deposition in the plaque, in the coronary blood vessels. And their score was up to close to 1,000. And I called one of them and told them, I said, I don't want you to don't want to scare you, but you really need to take some measures. Unfortunately, it was too late. He had a heart attack 2 weeks later. So his score was like 1,000, and he had no idea. He was like my age, wasn't that, he was maybe 20 pounds overweight, but he had high blood pressure, high cholesterol. He didn't exercise, and when he walked really slow. It's not a good sign of health. And I just told him, I said, "You're at high risk, sir." And he said, "You saved my life." I'm like, "Well, how did I save your life?" He said, "If you hadn't given me that warning without that test, if when I had the symptoms of a heart attack, I didn't realize I was having a heart attack." My wife said, "Remember, Dr. Sharif told you you're about ready to have a heart attack. So I'm not letting you drive. I'm going to have the ambulance come get you." And that he thought that saved his life, because if he had driven himself, what if something happened on the road? So that's one test. What's your question?
I was just wondering if that sheet could be made bigger, so we could see it.
Zoom in on your computer.
Does that help?
A little bit.
Okay. All right.
Thank you.
You're welcome. So then there's a carotid ultrasound. There's a simple blood test called lipoprotein A and ApoB. Those are advanced kind of lipid markers. And I'd say conventional doctors, almost with hardly any exception, they do not order those tests. In fact, so far, I have never seen a conventional doctor, and I say that respectfully, I've never seen him order the coronary calcium scoring test. Like, my mother saw a cardiologist for 20 some years. The doctor was a professor at University of Washington. He never ordered a coronary calcium scoring test for her. So it's just some of these tests are not conventionally done. And I think it must have to do with insurance. I'm not sure why they don't, because they're valuable tests. Like the lipoprotein A, you can look that up. If your lipoprotein A is elevated, it puts you at 3 times, I think, the risk of cardiovascular disease. And nobody runs that test except for alternative-minded practitioners. Yeah.
So I've heard that the reason they don't do that is because the insurance company
Yes.
pays for everything. So, but if you specifically push your doctor to say, "I want this test done," then that's a different story. But they're not going to necessarily put it out there because the insurance companies don't want them to do that.
To order the test, you mean?
Right. What do you think about that?
I don't know. Honestly, I don't know much about the politics of medicine.
Well, that's what I've heard.
I think
It's really, a money political.
It
game.
is,
You
it
you
is.
think, well, that's not right.
It is.
But unfortunately, sometimes
Yes,
that's the culture we live in.
I know. It's just a lot of politics. There's no great scientific reason not to order any of these tests. There really isn't. There's tons of evidence that tells us these are valuable, potentially life-saving measures.
Right.
So basic things like blood pressure, people don't take that seriously. Extremely serious that your blood pressure is within normal range. Diabetes screening is absolutely necessary once a year, I think, or every other year for someone who's over 40 or 50 or runs the risk of having diabetes. So these are just basic tests. But as far as other more advanced tests, there are so many. Like for cancer screening, besides the standardized standard screening tests, there are some multi-cancer early detection tests that are coming out that are just amazing. Like there's one that I'm offering at my office. It's a recent test. It costs $650, and it's called a multi-cancer early detection test. So they literally look for over 50 different types of cancers. And how reliable is it? None of these tests are 100% reliable, but they can give you some information. So if some of the markers are elevated, then you can go talk to a specialist and do further testing. So I really think that question was a really good question. This was the question right there. New technology that can scan your body or blood for certain diseases. There are so many coming out. And I just learned about this cancer screening test. I'm excited to offer that at my office, this one right there.
Is that a blood test or how do they do it?
I believe it's a blood test. Yeah, I just learned about it last week. So I'm going to be offering that.
Fairly new then.
Fairly new, yeah. So, and then there's some simple things like a fecal occult blood test where they look for blood in your stools. Well, everybody should have that done once a year. Why? Because if you have blood in your stools, it's high risk of colon cancer. And I just don't think most of us have that done. How many of you guys have that done? Have had that done? Like 2. See, I think most of us are over 50 in this room, right? So like for over 40, 45, 50. So we should all have that done, like once a year. I think it's certainly not like a colonoscopy, but I forget the statistics. I think you can catch 60% of colon cancers. It's just a stool test. So, it should be done. And then people that don't want to do colonoscopy, they could do this thing called Cologuard. It's another stool test. It's highly reliable. It's like there's lots of evidence that can give us good information. Okay, so next question. How do you kill viruses that can cause warts? Well, The virus that causes most common warts is called HPV. I don't know of a drug. I don't believe there is a medication that can kill that virus. But the idea is not killing the virus. So that question, I mean, it's a good question, but really the answer would be that's not how you get rid of warts. So you don't kill the virus that causes warts. You change the environment in the person's body that can make the environment. You want to change it so it's unfriendly for the wart to stick around. So that's how you approach warts. And in natural medicine, based on what I've learned, the best way to get rid of warts by far is. See, I wrote this. This is my Dr. Derm ND website. This is where one of my main specialties is actually dermatology, natural dermatology. And I wrote an article on the subject of warts right there. And I have videos of before and after videos of patients with warts, like 50 of them. You can go to that website and look at it. Every single one of them was treated by one remedy. It's like less than $20. And it literally cured it. So, that's why I wrote that article. I'm like, people should know that this is actually, it's a really valuable, effective treatment for warts right there. You can go to warts right there. This is kind of slow, but see, these are my own patients before and after. This gentleman had warts all over his fingers, and you can go look at them. And they literally disappeared in 2 months. This gal had warts before and after. It's a boy right there. I mean, I'm not going to take your time going through this, but I literally have over 50 videos and pictures of patients with warts. So that's the answer to that question. Like, how do you get rid of warts? You don't kill the virus. You improve the person's health. So when you're healthy enough, things just leave you. So that's basically the philosophy of natural medicine, raise the person's health. With warts, it's very simple. Just one homeopathic remedy, the environment becomes unfriendly, the virus leaves. It's just like that. Coincidentally, that's how we treat COVID too. All viral illnesses, COVID, the flu, common cold. You just find a remedy that matches. The way homeopathy works, you find a remedy that matches the patient's signs and symptoms. So whatever the signs and symptoms are, let's say a COVID patient comes in and they have a horrible cough and it's a dry cough, and they have body aches, but it's worse on the left side of the body. They're thirsty for cold water. All these symptoms that are very subtle, patients may not pay attention to. I take all that into consideration. I'm like, oh, there's a remedy that matches that set of signs and symptoms. And that remedy is called bryonia, which was the top homeopathic remedy for the treatment of management of COVID. So you go by signs and symptoms. So it's not like I have a disease, let's say I have the flu, what's a good remedy for that? That's not how homeopathy works. That may be how you can prescribe herbs and nutrients and pharmaceutical medications. But for homeopathy, it's very specific. Like if you say I have a cough or I have COVID or whatever condition works, I'm like, well, tell me about it. We ask a lot of detailed questions, which can be annoying. Patients get overwhelmed sometimes. They're like, how many questions are you going to ask? I'm like, well, I have to figure out all the details about your particular condition. Then I find a remedy that matches it. So we're like matchmakers. So we're like, that's because you could have COVID and benefit from 20 different remedies. So there are no remedies in homeopathy, there's no remedies for particular disease. There are remedies for syndromes. There are remedies for a set of signs and symptoms. Does that make sense? So if you have let's say COVID and you have left-sided symptoms and you have a dry cough, that's one remedy. But if you have right-sided symptoms and you have a wet cough, that's a totally different remedy. You could both have COVID. So we don't really have treatments for COVID per se, or any disease. We have remedies for signs and symptoms. So if you say I have a sore throat, what's a good remedy for that? I'm like, well, then you must be new to homeopathy, because that's like, we have like 55 remedies for sore throats. Tell me more about the sore throat. Is it right-sided, left-sided, or right-sided? Does your sore throat feel better with warm water or cold water? How does talking affect it? Do you have any other symptoms? Do you have a headache that goes with it? Do you have a fever? We ask all these questions, and I'm like, oh, okay, it's a right-sided sore throat better with hot water, lycopodium. That's the remedy. But if it's left-sided sore throat and it's you were really thirsty, then you particularly want cold water and you have a horrible, nasty headache on top, and it's worse on the left side also, it's a clear bryonia case. That's the name of the remedy. You see, so they're both sore throats, but it's different remedies, and it gets really tricky. Homeopathy is really tricky. You have to have a lot of experience. It took me a long time to feel proficient. It really did.
Could you address that question there? That's my sister, and she has to go because today's her husband's birthday.
Oh.
Who is your sister?
Birthday angel.
Okay, hi. Okay, sure.
Yeah.
So what's the question? Enlarging right mediastinal and left hilar lymphadenopathy. I was going to talk about lymph issues here. Concerning for neoplastic disease progression. Consider tissue sampling if going
You've
forward.
gone through 2 bouts of cancer.
Pardon?
You've gone through the 2 treatments for
I've
cancer.
only gone through the PET scan, and she wanted to do the MUGA. You know what the MUGA is?
I don't.
It has to do with the heart. One of my chambers, they wanted to make sure that the blood flowed when I'm on chemo.
Okay.
So I was a little leery about taking that, that one.
So we should talk, I think, outside of the setting, but let me read the rest. Long nudges.
He's kind of saying what I've said. Jesus said, I must increase and you must decrease. So if you raise the level up, the rest of it's going to go away.
Yeah. So I can tell you, your question, a lot of, this entire pitch has to do with lymphs, right? Lymph nodes and lymphadenopathy, right? So let me see if the section I'm going to cover on the lymphatic system would answer any of your questions. Can we do that? And you said you have to go. So I'm going to jump forward there, lymphatic flow. So the lymphatic system is one of the body's major housekeeping and immune systems. So we have 2 different fluids in the body, two main fluids. One is blood, one is lymph. So we all know about the blood, but hardly anybody knows anything about lymph. So lymph is kind of like, it's like your sewage system, basically. So a lot of garbage gets stuck in the lymphatic system and needs to come out. But to break it down, these are the different things the lymphatic system does. It maintains fluid balance. It's a critical part of the immune system. It filters pathogens. You see all the red? It absorbs dietary fats. It helps remove waste. It plays a role in cancer, et cetera, et cetera. And then those are the various components of the lymphatic system: the bone marrow, thymus, spleen, lymph nodes, tonsils, Peyer's patches in the intestines, and appendix. So those things make up your lymphatic system. So if you have any lymphatic issues, we should be questioning, well, do you have is your bone marrow okay? How's your thymus, which sits right here behind your breastbone? How's your spleen functioning, which is right here? Lymph nodes, do you have any enlarged lymph nodes? If so, are they palpable? Are they internal? Tonsils, Peyer's patches are in the intestines and in the appendix. So those are different parts of it, but what you ought to know is that unlike the cardiovascular system, the lymphatic system doesn't have a pump. So the cardiovascular system has the heart as a pump. The lymphatic system, there's no pump for it, and the fluid is supposed to circulate. So how does the lymphatic flow circulate without a pump? The pump is your muscles. So if you don't move, your lymphatic system gets all clogged up. So that's the reason we must move. That's one of the reasons we must move. And exercise is like the best way to help your lymphatic system. So if you have any lymph issues, my top advice to you is you got to walk. Yeah, walk. If you can, gentle aerobic exercise like elliptical machine would be like the best, like far better than any medicines I can think of. If you have lymph issues, really any issues, but lymph in particular, I'm a big fan of exercising. Patients that don't exercise, they just don't get better nearly as fast as patients that do. In fact, patients that exercise regularly usually don't even get sick. If they do, it's like they get over it fast. When I get somebody who's overweight, doesn't exercise, diabetic, metabolic disease, I know it's going to be much harder for them to heal. It's just obvious. But people that exercise, they kick anything faster. So what was I going to say about the lymphatics? What else was I going to say? Our medicine is holistic. So when I read that, I'm like, this isn't just about a matter of you having issues with your lymphatic system. I would question your digestive system. I'd question your liver. I'd question your exercise, whether you exercise or not, your diet. So it's all related. So if your diet is not healthy and you're not exercising, and your digestive system is compromised, that's going to affect your lymphatic system. I've had patients with various lymph issues. Let me talk about that right here. These are common disorders of the lymphatic system. Lymphedema. And by the way, I only had like an hour to work on this last night. So I usually I spent a lot of time on my talk. So this was last minute. So it's not perfect. So Well, none of my talks are perfect, but I try. But this is just last minute stuff I put together. So lymph edema, that's a condition where your lymphatic system your lymph doesn't move properly. So different parts of your body affected by the lymphedema they get enlarged, they get puffy. So I've had patients with lymphedema where like one of the lower extremities is just like twice the size of the other side. Yeah. So lymphedema it can be a nasty condition. There are no drugs for it. There are some herbs and homeopathic products that can improve the lymph flow. But the best thing for lymphatic issues would be what? Walking, movement. But some people have severe lymphedema, and walking is not enough. So what do? Then you can do lymph massage. There's something called lymphatic drainage. You see that right there? Like someone who has a massage therapist who has experience with lymphatic drainage, they can drain the lymph if that area is accessible. But if it's internal in your trunk, then how do you improve the lymph flow in your trunk? You can put castor oil on top of your skin. Castor oil, but no heat. If you suspect cancer, you don't want to apply heat on top of an area that potentially has cancer. So you just put castor oil all over that area, your trunk, let's say, and let it stay on for let's say an hour a day. That can help improve the lymph inside. And if it's on your extremities, you can still apply castor oil, but with your extremities, you can move them. So the muscles will move the lymph. But in your trunk, I mean, you can move, but I think the best thing to do, one of the best things to do is to put castor oil directly on your trunk. So lymphedema, I had a patient who was about ready, like literally she had a few months left. She'd been to the Mayo Clinic. Lymphedema was severe, like the entire left lower extremity was like a cesspool. And they told her, you have lymphedema, there's not much we can do for you, and here's antibiotics. They keep giving antibiotics because her leg would keep getting infected. So I told her about castor oil application. I gave her some supplements to improve liver health, encouraged her to exercise, and then she learned how to do lymphatic drainage herself. And she got these compression socks on her. She basically wore them 24/7, or at least during the day. And she's still alive. It's been 20 years. Yeah, her video, she taught me about lymphedema. I learned a lot from her just working with her back and forth. And she and I put together a 1 hour long videos on my website under educational videos. So you can hear her name is Teresa. Yes, she wasn't given much time to live. And I didn't do anything amazing. It was just like, okay, your liver basically sucks up the lymph from the lower extremities. It's like it improves lymph flow, even though it's not like a heart. It's not like the heart. It's not a pump, but it actually can help improve the lymph flow from the lower extremities upward. So your liver health is extremely important when you have any kind of a lymph issue. So for you, that would be critical. And then, yeah, like I said, liver supportive therapies, castor oil, we improve her diet. And then she learned how to do her own lymphatic drainage. So she would massage her legs like the affected like 1 hour a day. I think like at least an hour of massage herself. And then compression, stocking, and she's fine. Her leg is not perfect, but it'll never be perfect, unfortunately. But it doesn't get infected anymore, and it's not twice as large as the unaffected side. It's probably less than 1.3 times the size. It used to be twice as large. So
Castor oil.
Right? Yeah,
that's like 100 years ago.
Thousands of years ago. Yeah,
how does that work?
Through the skin, it goes inside and improves the lymphatic flow. It goes inside the body, and when it gets to the lymph vessels, it improves the lymph flow from one point to another. It literally does that. That's its property. So, and you can study it, but that's what it does.
You don't drink it.
No, you can, but it causes it's a purgative, so it makes you have diarrhea.
Yeah.
And you can do that once in a while too, and like a teaspoon of it. I don't recommend that usually. I just tell people to put it on. Like you put it on your abdomen, and it does the same thing without.
That used to be a punishment when we were kids.
Yeah, right.
Drink it?
Yeah.
So where does it, I'm going a little off. Where does it come from?
It comes from castor beans. It comes from castor beans, and then you cannot eat castor beans. It's highly toxic. But the oil comes from castor beans, and they took the toxic part out. But it's still not something that your body enjoys taking in. So when you have a teaspoon, your body wants to, get
push everything out.
push it. Yeah, exactly. So as far as there are many different types of lymphatic issues like lymphadenitis. That's the inflammation of the lymph nodes. A lot of people come in, I've seen many, they come in, like the lymph nodes are enlarged. Either here, I'm talking permanently, like permanently enlarged lymph nodes, different parts of the body. And of course, conventional medicine, really, as a rule, they don't have much to offer for lymph issues. That's just not their thing. That's one system where I can say, we don't know, of course, we don't know all about any of the systems either, but I think natural medicine, we do more with lymph issues than conventional practitioners. They just don't understand it. They don't have experience with it. There are no therapies, there are no drugs that can improve with lymph flow and lymphatic system conditions and diseases. There just aren't, we don't have anything. But in our medicine, we have castor oil, and we have herbs, we have homeopathic remedies that literally improve lymph flow, and we talk about exercise. And these patients that have chronically enlarged lymph nodes, I honestly don't remember one that I haven't been able to help, regardless of the age. We can help them. Homeopathic remedies are fantastic for that. Like there's a remedy called silica, is one of our top homeopathic remedies for enlarged lymph nodes. There's one called burrito carb. I have a child that I see, he's like 2-3 years old. He's not growing. He's just small, extremely small. I think he's like a 1 percentile height and weight. That's when I saw him. And now he's close to 10 percentile. It's been 3-4 months. He wasn't talking hardly at all. Now he's talking. He's having better bowel movements. The lymph nodes are shrinking. It's all happening with one remedy. It's called burrito carb. It's helping him develop. Like he was stuck. He was stuck developmentally. So the remedy burrito carb is for people whose nervous system is stuck. It's just whether it's due to genetics or stroke or whatever it might be. If the nervous system gets stuck and is you could say damaged, but underdeveloped is a better word, I think. Burrito carb is the remedy for that. I have a patient who had a stroke, and he couldn't move or talk at all, and he's a virtual patient. The same remedy I gave him, and he's like 7 years old. The child is 2 years old, and the child is not thriving. The man had a stroke, but the same remedy is helping both. Why? Because both of them have one thing in common: the brain is underdeveloped. The brain is underdeveloped. The other one, the man with the stroke, his brain got damaged, but it's as if is underdeveloped because he can't talk, he can't move. It's like the brain is obviously damaged. And burrito carb is helping him talk now. It's been 2 months. I just saw him virtually yesterday. And I said hello. He said, hello, just like that. 2 months ago, he couldn't say a word. Isn't that sweet? And then he can use the affected side a little bit now. He couldn't use the right hand at all. Now he can move it a little bit. Not fast. Progress is slow, but this is improving. And that boy, the 2-year-old, he's growing and the lymph nodes are shrinking with all one remedy. That's homeopathy. This is why I think homeopathy is something you guys should really know about. Most people don't know anything about homeopathy. They know about herbs, they know about vitamins, but when it comes to homeopathy, most people have no idea what it is. Now, lymphoma is a humbling condition. Our mother had lymphoma, and I tried to help her for months, and I couldn't help her at all. So lymphoma is the cancer of the lymph nodes. That's when the lymph nodes are cancerous. Now, not all cancerous conditions of the lymphatic system are going to be the same, but she did have advanced lymphoma, and she had to have immunotherapy, which helped her profoundly. Immunotherapy got rid of the enlarged lymph nodes quickly. So there is a place for conventional medicine.
Can you make that sheet bigger again?
Yes. So I tell patients, if you don't know what to do for your condition, talk to both sides. Talk to your conventional practitioner. Talk to us too. Patients sometimes are like, well, what can you do for sinusitis? I'm like, I only have 3,000 patients for sinusitis. What made you feel like we can't treat sinusitis? Like, where did you get that idea? And they're like, I don't know. I just thought I need antibiotics. I'm like, I understand. But next time you have a condition, email me and say, hey, Dr. Sharif, I got this. Can you help me? And if I don't, then I can tell you I can't help you. But if I can't, then why wouldn't you want to do this? Instead of using antibiotics every single time for the last 30 years for the sinusitis, let's just cure it.
What would you say about a person who is cold when the weather is 80 degrees?
There are a lot of patients like that. They're obviously the body is not balanced, and they need natural medicine. There are no drugs for that. They need natural medicine. What do they need? It depends on the case. It depends on the case. But I'd say, as a rule, I often go to, I think homeopathy. I'm like a person that's really cold like that. My first question for them would be, are you anxious? If they're running highly anxious and they're cold, then the next question for me would be, is there a location in your body where you experience a burning sensation? If they say yes, that's 3 checks. The remedy would be arsenicum album. There's a homeopathic remedy for people like that. Remember the matchmaking? So if you're extremely cold overall, chilly always, and then you have a certain part of your body that experiences a burning sensation, which is kind of odd. Like you're cold, but you have a burning sensation in your esophagus or in your feet. Or I had a female patient a few weeks ago. She said she was always chill. Like in my office, she had 3 jackets on, but she said she had an extremely uncomfortable burning sensation in her female parts. And then I said, so I thought, oh, she probably needs arsenicum album. So I asked her, are you anxious? She said, my anxiety is 10 out of 10. Gave her arsenicum, immediately helped her. That first night, the burning sensation in her vaginal area completely stopped the first night. I saw her 2 days later for follow-up. I'm like, how's it burning? She's like, I'm not burning. And I'm like, how is that anxiety? She said, I feel a lot calmer too. So it's like the remedy kind of balances you, but how do you find the right remedy to balance the person? You get a list of the signs and symptoms. And most patients don't know what a sign and symptom really is. They think it's something, they think that cough is a symptom. I'm like, yes, but if you're never thirsty and you become thirsty when you're sick, that's a symptom too, right? Or if you're always cold, like me, I'm always kind of colder, but all of a sudden you catch, let's say, the flu and you become hot, that's a symptom. Even if you don't have a fever, that's still a symptom. So that's the thing. I think people ask me, can I use AI to find my remedy? I'm like, well, if you knew homeopathy, well, you could. But because you don't know homeopathy, you don't know what information to feed it.
Lack of iron has something to do with it. I kind of have lack of iron.
Lack of iron, yeah, that could be a part of it. Yeah, there's.
I'm not anemic, right?
Yes, that could be a part of it. Yes. But,
Taking some supplemental iron can boost it up.
well, if you're missing iron, if you're low in iron, yes. But usually people with low iron, they're not that cold.
No, I'm not super.
Yes.
Kind of different.
Right. So, so I think that's basically enough for the lymphatic system. The next question is, what's the best supplement for the immune support? There are clearly like countless supplements that can support the immune system. My favorite one, my whole family knows, is called Super Bio Vegetarian. That's just happens to be my favorite. It's from the company called Priority One. It's got antivirals, ingredients, antibacterial, immune boosting. So it's a really good, all well-rounded antimicrobial and immune boosting supplement. But I also recommend homeopathic thymus. Thymus 4-CH, it boosts the thymus gland, the health of the thymus gland, which has a lot to do with your lymphatic system. So I really like that supplement as well, like periodic use of thymus 4-CH. And not every day, not when you're sick, but just periodic, like once a week, you take a dose of thymus 4-CH. See, every one of these questions, honestly, we could spend an hour on. I'm just kind of touching on it and moving on. Next question is it important to take thymus bovine or lymph bovine if you have poor immune system? I think that's a really good question. And remember, the thymus gland is a part of the lymphatic system. Remember, the lymphatic system has different parts. One is the thymus. Well, you can take thymus from the cows. That's what bovine means, right? Like from the cows, you can literally extract the thymus gland and make pills from it. Taking that has been shown to boost the health of the immune system. There's an article. If you guys know Dr. Mercola, who knows Dr. Mercola here? Okay, a few. Okay, if you don't, you really should subscribe to Dr. Mercola. He has the largest natural medicine database in the country, if maybe the world. So he puts out one article every night around midnight, and he's got people working for him because you can't do that at one doctor. So I'm sure he's got many doctors working for him. So it's an amazing database. So that's an article that he wrote on the thymus gland. If you really want to learn about the thymus gland, I would say go read that. Go look at that article. Right here. That's the article. I actually brought it up just so you can see it. Right there. No. The article. Is that right there? I think I don't know what happened to it. It was here somewhere. Right there. No. This one. Right there. See, it says thymus. So Dr. Mercola, I think he writes amazing articles. And this one is on thymus, which is, again, it's a part of the body that we don't know much about. So that's a good, useful article if you want to learn about the thymus gland. So that's the answer to that question. Like, is it helpful to take bovine thymus if you have poor immune system? The answer is definitely yes. They've done studies. Adults with healthier thymus tissue were about half as likely to die during a 12-year study period. Does that surprise you? Like the thymus gland sitting right here. So if you have a healthier thymus gland, you're half as likely to die during a 12-year study. Isn't that, I think that's pretty profound. Cancer patients with healthier thymus function tended to respond better to immunotherapy and survive longer across multiple cancer types. So supporting your thymus gland, I think, is smart. And homeopathic thymus, or taking thymus from the cows, bovine thymus, are two different ways of improving your immune system. So will heat destroy cancer cells? The short answer to that is yes, but under the right conditions. So sauna is not enough. Somebody asked about that. Sauna by itself is not enough, but it's an amazing step to improving your health. It definitely improves cardiovascular health. It lowers your risk of cancer. I think regular sauna use is amazing. Highly recommended, but will it directly kill cancer cells? Not based on studies. At least I'm not aware of any studies that show that. But heat does kill cancer cells. It's just got to be right under the right conditions. They use it. They call it hyperthermia therapy. So hyperthermia therapy is a medical treatment, but it's supposed to be an adjunctive therapy. So like you can make cancer cells much more sensitive to radiation therapy if you're receiving hyperthermia treatment. So you're receiving heat therapy, and then you get radiation. The radiation will work better. Or if you're receiving heat therapy and you get chemotherapy, the chemotherapy will work better. So it's an adjunct. It should be used adjunctively with other therapies that are established. Does that make sense? So don't think heat is enough. In fact, applying heat onto an area that has cancer, you should be really careful. I would say talk to professionals because it can actually spread the cancer. So you don't want to put, if you have, let's say, colon cancer, you don't want to put castor oil on with a heating pad. That's not a good idea. You can put castor oil on, but not the heating pad. So we're moving on. Question 8, macular degeneration. Of all the eye diseases I've helped patients with, macular degeneration to me and cataracts are the top 2 easiest conditions to help patients with. And people are always surprised to hear that we can actually help patients with eye diseases. They're like, why? I have an eye condition. I'm going to see my eye doctor for that. I'm like, well, what do you have? Cataracts. I'm like, we have drops for that. We have homeopathic drops for cataracts. And I've been blessed, and I've seen a few patients with cataracts that using those drops, they reverse the cataracts. So it's kind of interesting because when you practice long enough, you see things. So, and I've seen macular degeneration go away at least in 3-4 cases. And what do they need? Good vegetables and fruit. Macular degeneration is the nutritional deficiency disease. It's caused by nutritional deficiencies. It's different than glaucoma, for example. Glaucoma, I don't think is necessarily due to nutritional deficiencies. It's a mechanical and chemical imbalance in the eyes. But macular degeneration is almost an exclusively chemical. And what do I mean by that? They're nutritionally deficient. And what's the deficiency? Vitamins and minerals. So they need to eat more vegetables and fruit. That's it, simple as that. I had a relative with macular degeneration, I believe using different types of berries in about, I don't remember, a year or two. I believe macular degeneration was either greatly alleviated or was gone or something impressive. And I've had patients with macular degeneration just eating better, like a higher amount of produce in their daily diet, the macular degeneration definitely improved. So if you're told you have that, you should be questioning your diet. By the way, we have a machine at our office where you put your finger on it and it literally scans the amount of carotenoids in your body. And carotenoids come from vegetables and fruit. So I run that test for everybody. I'm like, let's see how much vegetable and fruit is in your body. And it's a GPA of your last year's consumption of produce. It's not just last day or last week. And it's like the moment of truth. So, yeah. So some patients, a lot of patients really most patients don't do well on that test. And, I can guesstimate. I'm like, I look at people, I'm like, I think that person's nutritional score is I give them a grade. I'm like, probably a C or a D or flunk. They flunk it. I know they're not going to flunk. And I'm often right. Sometimes I'm wrong, but I'm usually I'm right about that. And they're like, how did you know? I'm like, your skin tone, I'm like, you want the truth? Like, you're heavy, for example, you're heavy. I can tell you don't exercise. Your skin tone is unhealthy for your age. You have 8 different chronic diseases. There's almost no way your nutritional score is going to be high. But you get somebody who's fit, they glow, and they're agile, and they talk. You can tell by their speech, their brain is ticking. Those people's nutritional score is always high. You can tell just looking at them, yeah. So again, we can talk about macular degeneration for an hour, but I'm just going to move on. So I wrote a blog on eye health when I started practicing 20 years ago. That one blog has probably brought 50 patients to our office. It's interesting. People read. So like even from other states and even from Canada, people contact our office like, Dr. Sharif wrote an article about eyes and I have glaucoma. Can I see him? It's gonna interest. That one blog is really cool. The message, take-home message is if you have eye problems or problems with any part of your body, it's an reflection on your entire body. So it's like just because you have eye disease doesn't mean the rest of your body is healthy. It's almost impossible. If you have some, maybe it's possible, but I'd say it's extremely unlikely for you to have a part that's diseased, really diseased, and then you have perfect health else throughout the rest of your body. That's very extremely unlikely because the eyes are sitting in the body, or your brain is sitting on top of your body. So if you have brain issues or eye issues or toe issues, you should be thinking, well, what's going on with my body, my entire body, and mine too.
That's biblical.
Exactly.
If one part of your body hurts, the rest of the body hurts.
I love it. I love it. You shared the verses with me.
Yeah.
Mm-hmm. I'm sure it is. So, so that's why when people say, "Can you help blank?" my answer is always yes. I'm like, I can help it. I'm not claiming we can cure it, but I can help it. They're like, how do you know? I'm like, because when you just change your diet and exercise, if you just start to walk and eat healthier and take a few nutritional supplements and maybe a homeopathic remedy, how can you not improve? It's possible you may not, but it's extremely unlikely. So you will improve. So that's why I'm sure I can help you no matter what you have. And people are like, well, have you ever seen a patient with this weird genetic disease? And I'm like, well, can you spell that for me? Because sometimes I haven't, genetic diseases are odd. There are like hundreds of them. And I probably honestly don't remember most of them. And I don't think most doctors do unless they're geneticists. So, and I'm like, what is the name of that disease? So I look it up right in front of them. I Google it. I'm like, okay, you have this very odd genetic disease. Let's see what parts of the body are affected. And then I find that it's their intestines, for example. I'm like, okay, and then what else? Your skin too. Okay, so let's target those organs using natural therapies to improve the health of those body parts and the rest of you and see what happens. I have patients like that. It's unlikely for them. I honestly don't remember having someone with a genetic disease that I couldn't help noticeably. They can always help them. The question is how much, and that depends. That depends. So like I had a child, a 1-year-old who couldn't keep food down. He would vomit 8 times a day due to his genetic condition. He would vomit every time his mother would feed him, whether it was breast milk or bottle. He would vomit like literally 8, 9, 10 times a day. In fact, he vomited a couple of times in my office during the visit. I wasn't thrilled about that. That was I had to clean it up. So I just asked the mother about what I just said. I asked her one question. I said, what kind of milk do you give them? And the mom said, cow's milk. And I said, you've seen a pediatrician? Mom said, I've seen a pediatric gastroenterologist. And they just said, continue. And I said, well, can you just for 4 days not give them cow's milk and just give them some other milk, like a vegetarian milk, like rice milk? Just try it. And he's like, well, what if my baby doesn't get the nutrients? I'm like, your baby's throwing up everything. So I know. And she's like, okay, you're right. You have a point. So we did that. And the vomiting literally stopped in 24 hours. No more vomiting. It's simple as that. It was a genetic disease. All it took was like, I happen to know the top allergenic food in the country. If not the top, it's towards the top 2. Like there's gluten, dairy, right? You all probably know that. There's gluten and dairy. So dairy, I think, is even worse. So we just got that out of the baby's diet. Vomiting stopped completely. No medicines, no supplements, nothing. And guess what the pediatric gastroenterologist told the mom when he found out that this had happened? What do you think happened? What do you think the doctor would say? He didn't just say that. He said, if you don't give your child cow's milk, I can report you to people and they can take, yeah. I'm serious. And threaten her that you need to do that because that's by law. That's what you got to do. And literally said, I will report you. Yeah. And the mom was like, just got up and left. And I don't think he ever did, but did threaten her. Yeah. Instead of saying, what did the alternative medical practitioner recommend? I mean, tell me about that. And it's so common sense. If you throw up 8, 9, 10 times a day, you're going to be nutritionally. He wasn't thriving. He looked like he was a skeleton. So I'm like, we have lost common sense. We really have lost common sense as a species. It's terrible. So nice. We have a few more questions. Is it okay if I just continue answering them? Yeah. So this one is a very odd question. I didn't know anything about this condition, frontal lobe dementia. I don't know anything about that. So I had to look it up, frankly. And it makes sense. It's like the question is, can neurotransmitters be made new in frontal lobe dementia? Frontal lobe is right here. And the answer is yes, but the question is whether there are enough neurons remaining to produce a sufficient amount of neurotransmitters. That's the question. It makes sense. You're still making some. We're always making neurotransmitters, but the question is how much? And those are various neurotransmitters right there that we have in our brain, in case you're curious. So there's a lot to that disease and what can be done about it. Honestly, because it's not something I know much about, I'm just going to move on. But the answer to that question was yes. It's a progressive degenerative disease. By the way, neurological diseases that are progressive, like multiple sclerosis, Parkinson's, they're among some of the more difficult conditions that I see every day. And I end up helping some of them, but I have to say sometimes I'm humbled. Like Parkinson's patients, they're particularly difficult to treat. Multiple sclerosis patients have been far easier for me. I've helped a lot of patients with MS, but Parkinson's, and they're both neurodegenerative diseases where the nerves literally start to degenerate. Parkinson's, somehow they respond better to what I offer them, like significantly. They come in a wheelchair, and then 4 or 6 months later, they can walk with a cane. I've seen that. But Parkinson's, I wish I could report better results. It's more humbling, at least in my practice. Maybe I'm sure some other doctors they get different results, but I find it difficult. So how often, this is a good question. How often should I take iron? Well, it depends. Like if you don't have anemia, if you're not low in iron, you really should not be taking iron. So like men should not be taking iron unless they have anemia. And if you're a man with anemia, you got some imbalances that need to be addressed because it's extremely uncommon. It's not typical for a man to have anemia. Women that menstruate, of course, a lot of them end up with anemia because they lose iron. So menstruating women should take iron, at least in a multivitamin with iron, even if they're not anemic. But if they're anemic, then they should take the appropriate doses recommended by their practitioner. And so the short answer to that question is you need to be tested. So CBC and iron and ferritin levels should be tested. And based on the test results, we determine how much iron, and you should be checked regularly to make sure you don't overshoot. Too much iron is hard on your heart, it's hard on your liver, it's hard on different body parts. So you should always keep an eye on your ferritin. Ferritin is really important. It's the storage form of iron in the body, and you want to always keep an eye on your ferritin if you're anemic and you're taking iron. It's a blood test. Yeah, if you're taking iron, any gender for any reason, you should have your ferritin checked at least twice a year, because if you overshoot, you're going to hurt your body. And if you're not anemic, I mean, just let's say going in for a wellness check, I'd say most practitioners do not check the ferritin, but I think we should.
So if you're low on iron, you shouldn't take that medicine for a longer time. I mean, the supplement.
Right. If you don't want to take iron beyond what's necessary. Right.
One pill every other day.
Yeah, and you want to take it with food, and like every 3 to 6 months, keep an eye on it. So how do you help detoxify and restore brain function? See, like each one of these is such a huge subject, but I wrote that first. You see that first line? That was like my immediate response. Sleep is the most important thing for brain health. Good food and exercise is right there next to sleep, and then nutritional supplements. And at the end, I wrote plasmalogens is in large capital letters. You see that in capital letters. Has anyone heard of plasmalogens? So plasmalogens is something. If you're really interested in brain health, you should look that up. It's the kind of fat your brain is made of. It's the kind of fat your brain is made of. And some extremely published neuroscientist, neurochemist, he's American. He patented that, and so he actually sells these supplements called plasmalogens. He sells them. They're like fish oil. So like oils in capsule form, but it's the kind of oil that your brain is made of. So when you take plasmalogens orally, we have lots of studies showing you can improve brain health. The problem is they're extremely expensive. A few $100s. If you take a decent dose every month, it's at least $100 a month, maybe up to $200. It depends on with the dose. Am I messing this up? So, but then there is a longer list of things you can do to improve brain health. So, like exercising regularly is absolutely key for brain health. If you don't, your brain is just going to degenerate much faster. So you see someone like Pastor Ruben who looks so amazingly healthy, you can just logically deduce that he must exercise. I haven't asked you that, but every day, see? And he glows with health on every level. So you can tell he exercises because of the glow. And it's not just a spiritual glow. There's also physical glow. It's the sauna helps. The sauna helps, but there's also health in the various organs. Yes, it's true. It's a picture of
Can I
health.
just share on that?
Yes.
In the sauna every day since 1974. Infrared sauna, water aerobics.
Mm-hmm.
I chop wood, stack wood, carry wood, up 15 stairs, so Shirley can be warm. I'm staying busy.
Yes, and it really shows. Knock on wood. You look beautiful for your age.
He fell off a truck 4 years ago and his then popped right back up.
Yeah. No, it's amazing. I mean, I've been in practice 22 years. I've never seen someone in that age category look as amazing as you do. So Lord has blessed you. So exercising regularly is absolutely key. Correcting deficiencies. So to have good brain health, you want to correct all the deficiencies. So get your blood tested. Check your B12 levels, for example. Check your vitamin D, folate, iron. Any deficiency should be corrected to have good health, not just brain health. So omega-3s, we all know fish oil is good for the brain, right? Hopefully you all know that. So taking one fish oil pill a day is a good thing. It's a little something you're doing for your brain. It's not as powerful for the brain as the plasmalogens, but it's a good fat for the brain. Keep your brain active. So people that retire, they may not be quite as active. That's not good. You got to keep your brain active. The brain is made to work. So you got to constantly do different things to keep it alive. So reducing toxin exposure. So alcohol, smoking, heavy metals, solvents. Like I've seen patients that, let's say painters, they come in with brain fog. And I'm like, well, I think some of it is because of your job. So what are we going to do? So are you painting outdoors or indoors? I try to give them any kind of tips I might have. Or like if they're touching things that are, toxic chemicals, I'm like, wear gloves. I saw an electrician the other day. He said he'd been an electrician for decades, and he had he was developing dementia. And I checked his heavy metal levels. See right there, it says heavy metals right there. I checked his heavy metal levels. His lead levels were off the chart. And then I asked him, "You touch cables?" He said, "Yes, all day long." And I think he must have touched cables with lead. It went right through, and then his lead levels were off the chart. And I could tell just talking to him, he was just absent. You could tell he had dementia. And it was really sad. Lovely guy. But yeah, you don't want to touch things regularly unless you're sure it's not toxic. So cables and circuit boards, if you're touching circuit boards a lot, you gotta use gloves. Yeah.
It's the regularity of contact that causes the toxicity, right?
Yeah, if you once in a while, it may be okay, but every day, every day, multiple times a day for 40 years, this gentleman was an electrician. I don't know how else he would end up with such high levels of lead. I mean, that would be my first guess. It was just from his job. Maybe he was exposed some other way. I'm not sure. We tried to troubleshoot it. We couldn't come up with anything. His wife, and him had been together for this whole time. They just couldn't figure out any other source. It wasn't from their house. It wasn't from the water. It must have been from the cables. So that affected his brain. So this is a long answer to that question. And then let's move on to the last 2 or 3. What are your thoughts on Bowen therapy? Who has heard of Bowen therapy? If you've heard of Bowen therapy, raise your hand. So the person who asked that question is not even here.
That's Shirley.
Shirley, okay. So short answer is Bowen. This is a good way of summarizing it. There's different types of body work like chiropractic, massage, physical therapy. There's all kinds of ways to touch a person and help them with their touch, right? We call it physical medicine. Body work. Of all these different types of modalities within the world of body work, Bowen therapy is the most similar to homeopathy. So of all the medicines in the world, like there's drugs, herbs, nutritional supplements, homeopathic remedies, of all the medicines you can take orally, homeopathy, I'd say, is in this one way, it's at the top of the list in this one way, which is most likely, it's designed to stimulate self-healing. It's the only oral medication, you could say, or treatment that stimulates self-healing. I'm not saying it's the only treatment. It's the only oral medication that I'm aware of that something you can take orally that can stimulate self-healing. So homeopathic remedies stimulate self-healing. They're not anti-cancerous, they're not anti-inflammatories, they're not anti-this and anti-that. They just stimulate your body to heal itself. They change the terrain. And then when the person's health goes up, the disease goes away. So that's how homeopathy works. in the world of oral medications and oral therapies, homeopathy is, I'd say, at the top of the list of therapies that can stimulate self-healing. Herbs can do that, drugs can, I mean, they all can do that to some extent, but homeopathy, that's the only thing it does. I mean, that's like the job of homeopathic remedies. So Bowen therapy in the world of body work is also the one type of body work that's designed to stimulate self-healing. So in the world of physical medicine or hands-on therapies, Bowen therapists are very similar to homeopath. So homeopathy and Bowen therapy are very, very similar. With,
The reason she asked that, her sister-in-law came to visit her, and she's into that Bowen therapy.
yeah, yeah,
She was telling Shirley it was a great thing.
it's amazing. The practitioner just touches you.
Explain it a little.
Yeah, it's like I don't know much about it, but I've just seen it once. I've seen a Bowen therapist touch, work on a patient. It's extremely subtle. If you watch them work, you might think they're not doing anything. It looks kind of like craniosacral therapy. So the practitioner puts their hands on you. They're moving the fascia underneath your skin by very gentle, extremely gentle movements, extremely gentle. Chiropractors are like pushing bones and pulling, and you can see the chiropractor working. But these practitioners, their work is so subtle. If you're just looking at them, you may not sense what they're doing. But once they put their hands on you, you can feel the things they're doing. It's very the energy. You can move their moving things inside you, but it's very, very subtle. Yeah. So they both stimulate self-healing. I think that's a good answer for that question. It took me years to learn the difference. Like, what's unique about Bowen? It's like homeopathy, but it's hands-on. So osteoporosis, that is one of the most conditions that I get to, you could say, treat. I say the word treat sheepishly because it's extremely difficult to treat osteoporosis. These are the different stages of osteoporosis or bone density issues. There's osteopenia, there's mild osteoporosis, and there's moderate to severe osteoporosis. Osteopenia is just low bone density. So a lot of us over the age of 50, 60, women, sadly more than men, they have osteopenia. That's just low-grade bone loss. But then you go up one stage from that and you get mild osteoporosis. So for osteopenia and mild osteoporosis, natural medicine, I think, can help patients greatly. But once you get advanced, like severe osteoporosis, it's much more humbling. So as a rule, I tell patients, if you have severe osteoporosis, you should definitely work with me and a regular practitioner. You might benefit based on studies, not that, I mean, some studies are biased, but based on studies, osteoporosis patients do okay with pharmaceutical medications. But if you have osteopenia, I think you should just stick with natural medicine solely. And if it's mild osteoporosis, I still think natural medicine can help a lot. But you go into the advanced stages of osteoporosis, like ladies that have multiple fractures. Sometimes I get ladies that are like 85 years old. See right here. Someone comes in with a prior hip or vertebral fracture, horrible bone density results, multiple fractures. They come in, they've had like 8 fractures due to falls and accidents. If I see that, so they have a high fracture risk, I feel like by law, I mean, legally and ethically, I feel like I'm responsible to tell them, you should see a regular practitioner and work with me at the same time. Yes.
I'm working with a doctor now, and since my 60s, and I'm 81, I have the osteoporosis, the bad kind that keeps going minus. For 20 years, they've been trying to get me to use Fosamax, Prolia, and Valoxafen. And all of those drugs are notorious in causing necrosis, death of bone. Right. And I don't want to take that risk, so I told them no. So I tried this new drug 6 months ago. It's called Osteocal and Strontium. And it's a supplement. And it's made out of algae.
Yeah, is it Algae Plus or AlgaeCal? Yes, I know. Yes.
I had my report back, and I had my DEXA scan on July 17th, and that was the first thing that made a positive
wonderful
forward. I'm back to being osteopenia.
Oh, wonderful.
And I'm moving in the right direction, and I'm kind of excited, but
it's
a pretty heavily priced product.
I know. We have that at our office. Yeah. AlgaeCal Plus. That's a great supplement. It really is. It's got algae from the ocean and highly stromonium. Yeah. The strontium. Yeah. It contains a highly absorbable form of calcium. That supplement. It's true. Thanks for sharing. That's a great testimony. You didn't try pharmaceutical medications at all?
No, I wouldn't try those 3 because I know they're very
side effects.
Notorious.
I know.
And then I have there's many lawsuits, and
I know.
My one son went to school with his mother, his kid,
right.
His mother, And she took Fosamax for 4 years, and in 4 years she had 4 bone
I know.
operations and part of the bone removed
I know.
from the
I have heard stories like that too. That's why when patients ask me, should I use medications, pharmaceutical medications for osteoporosis? I don't flat out tell them yes, because I've read and heard stories like that. Because osteoporosis medications are notorious to cause side effects. But I feel like I feel like one, I clearly don't know it all. And then two, I'm liable in every way by telling them not to, especially because my treatments for advanced osteoporosis are not completely reliable. Like advanced osteoporosis patients, I haven't been able to completely turn them around. So my confidence level in treating advanced osteoporosis is not the highest. But mild, like osteopenia, moderate osteoporosis, I get good results. So for those patients, I feel comfortable asking them to work with me. Give it 6 months, and then we'll do a follow-up DEXA scan, bone density scan. But for advanced osteoporosis, I can't be quite as confident that, hey, I can take care of you. Don't use any pharmaceutical medications. I just don't want to be responsible for potentially their demise. Because imagine a person falling and fracturing their hip. I mean, I've heard a lot of stories of that could be a person's end. It's like imagine severe osteoporosis and you end up on bed, you can't move for months, and then you're older.
It's a gamble because it doesn't affect everybody that way.
I know.
90% or 80% at least it does.
I know. So that's a really tricky question. I think the way I answered it, I feel comfortable saying that if it's mild to moderate, I feel comfortable taking on the patient. If it's advanced, I tell them, we'll work with your conventional practitioner and me. And if you're not walking, you better start walking. Walking and exercising, weight-bearing exercise, absolutely critical for bone building, right? And there's the right supplements make a huge difference. And what supplements, by the way, these are just some of the top supplements that I think I listed here, right there. Exercise, proper protein intake, vitamin D, calcium, vitamin K, K2, magnesium, all the minerals, not just those vitamins and minerals that are listed there, but they're all important. Various nutrients right there, zinc, boron. So well-rounded multivitamin with vitamin D and K2, maybe a mineral supplement in addition to that, high protein intake, exercise, making sure your hormones are balanced. That's important too. If you're a female, you're 6 years old, let's say you're just perimenopausal or just became postmenopausal, you may want to consider having your hormones tested. And if your hormones are completely out of balance, you should work with someone, usually alternative medical practitioners, to balance your hormones, because the hormones completely affect your bone density. Yeah, like say there's one hormone called parathyroid hormone that comes out of the parathyroid glands. And we have a thyroid gland sitting right here. We have 4 parathyroid glands surrounding the thyroid gland. So the parathyroid glands have everything to do with your bone density and calcium levels in your body. So you should get your parathyroid glands checked. Some patients, a lot of primary care physicians, I think I'd say medical, conventional medical primary care, as well as naturopathic doctors, we don't check people's parathyroid hormone often enough. It's called PTH, parathyroid hormone. If you have osteoporosis, your PTH must be checked. And I think endocrinologists know better. They check, those guys are hormone specialists. They check your PTH levels. But a lot of regular conventional family docs, we just don't do that. I've learned to do that. I think it's an important test to do. Very important, PTH. So I thought that was funny. There's some emerging therapies for osteoporosis. One of them is prunes. And the reason I thought that was funny is because most patients with osteoporosis are older and they happen to be constipated. So there's an emerging therapy. Prunes can help with osteoporosis and constipation. So if you're, double whammy. It's true. I mean, it's really true. Most older ladies that I see with osteoporosis, I'd say the majority of them have constipation too. So I just learned that last night. 50 to 100 grams of prunes a day. And it's an emerging therapy. So let's see. I think those are the questions. Is there one more? Or there's one more. What's a great protein powder? Some of these questions I thought were cute. Like, what is a great protein powder? People thought I was like AI or something. Like, how am I supposed to? So quality matters. The best I can tell you here is that I have read so many articles recently by Dr. Mercola. I'm just overwhelmed by like the last month. He's put out 5, 6, 7 articles on quality of supplements. And look at this one, the truth behind supplements. What was that? Yeah. This is his articles have a story at a glance at the top. He just summarizes the whole thing into like 4 paragraphs. a few paragraphs. Can I zoom in? Okay, see right there. So the quality of supplements, it looks like it's going down. And these companies are promoting themselves as being highly scientific. So they hire smart people to work for them to prove that they have quality, but they have science behind the ingredients. They do have science behind ingredients, but the quality, that's a different matter. Isn't that interesting? Because they put out all these amazing articles, like we actually studied this particular supplement for this condition, and we have shown it to be effective. So you get impressed by the quality of the studies, but that doesn't mean the quality of the supplements is high. How do you know the quality of the supplement is high? You wouldn't know. You would have to. I call them and I'm like, do you have paperwork, that quality assurance paperwork to submit to us, that so I can trust your product? And the ones that are like, they want our business and they're solid, they immediately fax or email their quality assurance paperwork. But some of them, they just don't even call us back. So they probably haven't done this study. They haven't done the work. So what do you do in this questionable world? Like say protein powders in particular, the lead, I just read an article about that. Inside the lead, like the rim, they have found heavy metals inside a lot of these, the top part of the bottle. So I was like, I found that disturbing, like heavy metals in the lead of protein powders. 60% of them or something like that had been found to have heavy metals, cadmium and lead, and so it was kind of like, wow. Yeah, no, like you think you look at the inside, but what about the bottle? What about the lead? What about the paper that goes on top?
So is liquid better than?
I think this article was suggesting that powders were better. This one article I read, yeah, but I just think you should just make sure you check the company, like make sure the company is good. So here's something for you guys that you might find helpful. There is a source I use to order supplements for our office. It's called FullScript. Has anybody heard of FullScript? Okay, FullScript is like a professional supplement website distributor. Doctors have access to it. I don't believe they sell to non-healthcare practitioners. If you're a healthcare practitioner, you can sign up with them and they will send you like Amazon. I'll go to their website, FullScript, and I order whatever I want and they send it to me, to our office. So they have, I think, if not all, majority of the supplements are high quality. So like it's different than going to a retail store and to buy supplements from. So it's more legit. So most of the products that we have at our office are physician quality, they're high quality, and they come from FullScript. And if you want to have access to FullScript and you don't want to, let's say, necessarily see a healthcare practitioner like myself, you can go to that particular link, and then sign up under me. And just so you know, if you do that, they'll I'm not doing it for that purpose, but they'll give our office like a 1% of whatever you guys get. So I benefit from that, and I just want to. But I'm not promoting it for that reason. But it's like Amazon, but it's more trustworthy. Yeah. And if you know a healthcare practitioner that's into alternative medicine, everybody knows FullScript. And we all use FullScript. Naturopath, yeah. Some medical doctors do too. In fact, there's a medical doctor that I work with, and she uses FullScript recommends it to all her patients too. So it's a good, more respectable kind of a website than Amazon. Yeah, source. Yeah, and then so I'm done with the questions that Pastor Ruben had sent me last night. But as far as anything else I could show you, just remember these two websites and the email. You guys have my email, right? You can always go to the websites and contact me right there. And I have business cards in case somebody wants business cards. If you guys have any questions, you can email me anytime. I don't know how many. This might be more than enough. You can email me. You don't have to necessarily come in to see me. You can email me and say, hey, I met you at church. Here's a question for you. I'd be more than happy to respond. Yeah, you're welcome. You're welcome. And some patients are like, well, I like to see you, but I live in Tacoma. We accept virtual patients too, in case you need to have access to virtual visits. We do provide that. I'd be honored if you need help. And yeah. So and if you have any last minute questions, I can stay after the session here and answer questions individually. Yes.
I just have a little short question because I've been doing the castor oil and castor oil packs often, and we went and ordered it online. And the criteria that I used was definitely hexane free. But is there a particular brand that's better than the others? Organic glass.
Thank you. Organic glass is the best.
organic.
Organic glass, yeah.
And then it's pretty across the board.
That's based on what I know, yes.
Okay.
Yeah, I used to recommend the one in plastic and it was not organic. It's not, it's not as good.
Yeah, because it carries the hexane.
Yeah, I think so. Well, the plastic, some microplastic gets into the castor oil. The glass is, you can tell with the glass, the kind from the glass, organic in your hands and then put it on, it just feels significantly healthier. You can tell it's higher quality. It's clearer, and when you put it on, it feels better. I just go by how it feels.
The plastic is very sticky.
Yeah, it's sticky, and it doesn't seem as clear. You can tell there's some extra things in there that hopefully that don't belong.
Do you
Probably
recommend that the
microplastics.
belly button be used as the transport system or just
The whole abdomen, I just do it like from here down
Okay.
and the sides too. And you take a minute and rub it in. It does help when you rub it in, and then you let it stay on for like an hour at least a day. Yeah, I do that every night. It's like I've done it for 2 decades. You can put it anywhere you want. You can put it on your feet. If you put it on your feet and rub it in, it can actually help you sleep better. I do that too. Yeah, and then you can put socks on. You fall asleep like that. And it takes the aches and pains out of your feet. Yeah, it's amazing.
On your website, do you sell the B3K2?
Oh, and that's not my website. That's a full script is a national website. But if you go to that website, of course they have everything.
I just heard recently if you take that along with the algacal or any calcium you eat, it'll tell your body to put the calcium into the bone
Yes.
instead of the bloodstream.
Right. Taking vitamin D and K2 along with the calcium supplement is highly recommended. And that was listed as under the osteoporosis treatments. Yes, great idea.
I did full script through someone else before, and I went in there trying to get different products, and they wouldn't let me do anything other than the parameter of what the practitioner I had seen before. So how do I bypass that?
If you do that, they'll probably, I think Full Script sends me an email asking me to give you permission, and I will.
Oh, okay.
It happens automatically. They're like,
Okay.
so-and-so is waiting for your approval. And I mean, unless it's something that I think might be hurtful, let's say if it's iron, I don't approve until I see the patient. But if it's like a multivitamin, I'm like, how's that going to hurt? It'll probably help them. So I don't have to see you.
Then you'll probably have to approve whatever I want
I
before I can get it.
I think, well, I don't think every item on Full Script is going to require
just some
approval.
Certain ones.
I believe so, but I'm not
Okay.
100% certain. But if it's something that I feel like is potent, like iron isn't a good example.
Well, yeah.
I may say,
And which type of iron? Because there's some that are just like rocks for our body.
My favorite
Digest it.
company for iron is Floradex.
Right.
How
Yeah,
often-
Flora, the company Flora. Excellent iron. It's liquid and it's highly absorbable with
How
all its
often
brothers and
do you
sisters.
take it? How often?
The frequency of use of any of these nutritional supplements depends on the patient, on the case. So like iron, for someone whose ferritin is 10, it's low ferritin. They should take iron twice a day maybe. But for someone whose ferritin is 30, 40, 50, maybe they need it once a day. It all depends. Are they anemic or not?
You got a question here, Ken?
What's going to be done for vertigo?
It's a good question. For some reason, I've been seeing many more vertigo patients the last 6 months than I used to. I don't know why. I haven't figured out why, but I am seeing more vertigo cases. You might get sick and tired of hearing this, but the best treatment in my practice, because I'm not just a naturopath, but I'm also a homeopath. To me, the most effective treatment for most ailments is homeopathy. So I treat vertigo homeopathically by asking you like 50 questions. I figure out the exact match, and I give you a remedy for your particular kind of vertigo. And I can tell you, like right off the top remedy, homeopathic remedy for vertigo is called Cocculus. Cocculus, Coccolus, Cocculus 30C. You can buy it from a health food store and use one dose. There's almost no way it's going to hurt you. And I don't want to prescribe that, not knowing anything about your particular case of vertigo. But if you just try one dose of Cocculus, homeopathic Cocculus 30C, 30C is the potency of it. You try one dose of it and it helped you, then you can take one dose a day or every other day till it's gone. And if it doesn't go away in a week, you should really reach out to me. But if you try it one time and it doesn't help at all, then it's not worth repeating. So not knowing anything about you, if you said, what's a good safe thing to try? I'd say try homeopathic Cocculus. Not going to hurt you. Is a 50% chance it'll help you. If it does, you just try it every day, every other day till it's gone. If it's not gone within a week, you really should reach out. You should be getting better day by day. With homeopathy, you can have a lot high expectations. You don't take a remedy for a month to hoping it'll kick in. Majority of conditions, when you take the right homeopathic remedy, your condition should improve at least a little bit, every day. I'd say majority of conditions, not cancer, not say eczema, and not these things that are like some conditions are just hard to put a dent in a few days. But let's say vertigo, it's not that hard. When you take a remedy for vertigo, you should feel some improvement the same day. If you have a headache, same day. Diarrhea, same day. Itching, same day. But you have advanced, say, psoriasis, it's not going to look different. It might take 2-3 weeks for it to. So if you're a practitioner, you can make predictions like, oh, that's going to take 2 weeks. It's going to take a month. This is going to take 5 minutes. So like menopausal symptoms, hot flashes, 2 minutes. Right in the office, I give the right remedy to the lady, the hot flashes go away. So I expect that. I even tell them, I'm going to say, I tell them, I'm like, wait here 5 minutes. If I get rid of it here, you're like the other 90% of ladies I treat. But if I can't get rid of the hot flashes right now, then that means you need other therapies. So vertigo is one of those things you respond like that.
So you can get the calculus 30s.
You can get calculus 30C from PCC and some certain, maybe super supplements. They sell homeopathic products. Yeah, if vertigo could be caused by so many things. If you don't get better day by day, and if it's not gone in a week, you really should get evaluated. Yeah.
Can you explain what the vestibular system is?
It's a part of the inner ear that has to do with your balance. It involves the brain and the inner ear.
And is it actually a part like a...
Yeah, it's inside the inner ear.
Okay,
Yeah.
so it's not just a condition, it's a part.
Oh yeah, vestibular system is actually anatomical parts, certain anatomical parts in the human body. Yeah.
I got a quick question. Gout.
Gout?
Gout.
Oh, my first patient ever before I even became a licensed practitioner was a gentleman with gout. And it's like literally one of the easiest rheumatological conditions to treat. By far, it's one of the easiest. It can be disabling, but it's extremely straightforward. So you got to change, the person has to change their diet. Alcohol and red meat, you got to get rid of the alcohol. Red meat, reduce fats, animal fats. And then you improve liver and kidney function. And hopefully take a homeopathic remedy that matches that particular case of gout, and gout is gone. And if you have gouty, they call tophi, if you have those nodules, because gout can get really nasty and you develop bony nodules. If you have those tophi, then you definitely need to take a homeopathic remedy that targets them, and it literally dissolves them. Yeah.
You got a customer, I'll send my son to you because he can't walk. His big
Oh.
toe swells up.
No, I can help that.
His
I can help that.
knees,
I can help
he's
that.
paralyzed.
No, we have had so many gout patients. I'll be here if you have other questions. You're so welcome.
Thank you so much.
You're welcome. You're welcome.
Okay, let me
You're so welcome.
close by this to say what he's been teaching is what Jesus said, or what John said in John 3:30. He must increase and I must decrease. So what he's been basically saying, we increase the level of our health, all that other stuff has to leave, right? Is that kind of the bottom line?
Absolutely. And then this is something that right here, see the 7 steps to healing. This is something I typed up in my first year of practice. See at the very first, under appropriate lifestyle and diet, it says enhance your spiritual religious life. I talk about it with every patient.
Yeah.
Patients that have strong faith and have a religious practice, based on my humble experience, they heal far faster.
Wow.
Far faster. People that are atheists that come in, with all due respect for atheists, I know when the spirit is not aligned, they just don't heal as well.
Oh, right, of course.
And we all know that, but they don't, sadly. You're welcome.
Can I ask one more question?
You're welcome.
On the vestibular system, what do you do for that?
If you have issues with the vestibular system, it depends on your signs and symptoms. That depends on your signs and symptoms.
Okay, well, I haven't been officially diagnosed, but that's what my physical therapist I've seen for another reason, she thinks I might have.
That you have issues with your vestibular system.
She thinks,
Well, what are your signs and symptoms?
I'm just feeling off balance.
Thank you so much for your help.
I get just, I don't know, things. She had me follow her finger and I wasn't able to do that.
I can share this really might help you. I've had patients with balance issues
Like you get.
and they were seeing PT for a few months and they really weren't making too much progress. I give them a homeopathic remedy, their balance issues like improved